All right, guys. So for the hemoglobin A1c test, that's the next test we'll be looking at. And the hemoglobin A1c test is also known as what? Glycated hemoglobin test. So what do you actually mean when you say that hemoglobin is glycated? Now, hemoglobin, everybody knows what hemoglobin, right? Glucose, everybody knows what is glucose. So hemoglobin is basically that component of blood that transports oxygen. So when you have a patient that is having what? Too much levels of glucose in the body, some of this hemoglobin can actually what? Get combined with glucose. All right, but normally hemoglobin should not be combined like that. Or even if it is combined, there's a percentage to which it should be combined. Okay, so if you are checking for hemoglobin A1c test and you are seeing that the the percentage of uh, hemoglobin that is combined to glucose is actually elevated, you now start was suspecting some one or two problems. All right, so let's talk about it. We're saying what the hemoglobin A1c test, that's the HbA1c. It's a test that measures the average percentage of blood glucose levels. So basically, I'm just trying to check out what the amount of hemoglobin that is combined to glucose, right? So what is the purpose, right? It's mostly used to diagnose glucose related disease condition, especially diabetes. So you're trying to monitor for diabetes control, you are trying to assess for risks of complications, you are trying to evaluate effectiveness of treatment, right? You're trying to know how the treatment is going, how the patient is responding to treatment. Okay. That could be a reason why you're doing this too. Then how it works. So normally hemoglobin is actually a protein in red blood cell. It binds to glucose, right? So hemoglobin A1c forms. It actually forms when hemoglobin binds to glucose, right? So now you actually test to know the percentage of hemoglobin that is combined to glucose, right? So you see the interpretation of results. For normal hemoglobin levels combined with glucose, it should be less than what? 5.7 percentage in the whole body. All right. But if you are testing for hemoglobin combined with glucose and you're finding something from above 5.7, there's a problem. So if it is pre-diabetics, it should be from 5.7 to 6.4 percentage. That means the person is what? Going towards becoming diabetic, all right? Then the person is diabetic itself, that means 6.5, right? So what are the factors affecting how hemoglobin combines with glucose? It could be red blood cell lifespan, could be hemoglobin variant, could be anemia, could be kidney disease, could be liver disease, could be vitamin B12 deficiency, could be iron deficiency. Okay. So what are the advantages? Just the advantages of the test. Of course, the test will help us diagnose what any glucose related problem. All right, so that's it for hemoglobin A1c test, also known as what glycated hemoglobin. Basically, the hemoglobin in the body that is combined to glucose. Doing this test to diagnose some glucose related disease conditions like what diabetes.